we've heard about how the pandemic has impacted on different areas that we're working in. What I'd like you to focus on is, what have we learnt as civil society? What do we need as civil society, generally in public health terms, but also more specifically for this pandemic response? And then looking to the future, how can we build back better civil society involvement in public health? So those are the questions that I'd like you to focus on. Sven, if I can have the policy speakers all highlighted, please. The slides can go, Milka, thank you. And I'm aware that we've got some comments coming in from the floor already from different EPHA members. So if I can pass to you, John, for some initial thoughts, comments, reflection.
Well, first of all, I think it's absolutely clear to me that inequalities in health are due to inequalities in income. And we've seen in a decade of austerity, not just an erosion of the incomes of some of the poorest people in all our countries, but also an erosion of the services that they need, even more so in this difficult time and during pandemic. And worse still, I don't think anybody's quite conveyed the gross and grotesque widening of inequality during the pandemic, and the what Oxfam called the inequality virus, and the grotesque increase in wealth that some of our billionaires have achieved in the last 2 years is clearly something that we need to see addressed by our governments. I was asked 3 questions about what my organisation's involvement were. Well, ASFA is a non-governmental organisation. We are part of civil society, but many of our members would see themselves working in the fields of education, training, although more than a third of our members were involved in high-level policy advice to governments. So, you know, we don't function on the front line of social involvement, but we are strongly involved in that public health community. And indeed, many of our members do see their roles as being socially engaged. BLFL did a load of work with migrant communities. University College Dublin have worked across the sector, actually forming the contact tracing one of the suppliers in Ireland, and many of our schools in other parts of Europe have been active as social leaders. But in terms of what happens next, the public health, I see things as the health of the public, which is everybody's business, and then the public health service system, community, profession, as being the core group who, the grit in the oyster, or the catalyst, if you like, for making change on a population basis of the kind that David Nabarro was describing. So we have to have a robust, well-resourced, expert public health community, but we also have to have a healthy, engaged population, and we have to promote all of the improvements in housing, education, children's support, early years, all the things described by Freck and by Valeria. And so my organisation also then talks about planning for an outbreak of health, remembering with William Beveridge's planning for an outbreak of peace in the Second World War, that at that time it was a country fit for heroes that was being sought in the post-war welfare state. Our planning for an outbreak of better health should be about all those things, about improving income, fairness, achieving basic standards of housing, satisfying work, better environments. And what we've seen is the reverse in many ways, with all of the problems of the vaccine access being mirrored in the failures of the COP26. And we see an inertia and an unwillingness of our governments to really tackle the problems that face people. So I hope that's enough. Thanks very much, Alice.
Thank you, John. Absolutely. Jana, if I can go to you next, please.
Yeah, thanks, Alice, and good to be here. So I'm speaking on behalf of Eurochild, a European umbrella network of organizations promoting the rights of children. Very glad that Valeria Setti could speak earlier in the panel to the EU strategy on the rights of the child, which is an extremely welcome milestone that's putting children's rights at the heart of the EU. I guess my comment and reflection here is precisely how do we make the EU's initiatives in the follow-up, the recovery and resilience plans, and the all the work that goes into the macroeconomic governance framework of the EU, how do we reinforce that process to be inclusive of civil society partners and the people that we represent? I mean, we did do quite an exhaustive consultation with children, both in Europe and externally, inputting to the child guarantee and the EU strategy. But I think, building on what Chris mentioned earlier in the panel about participative democracy and how we are building on lived experience and in strengthening communities, I think that there's a huge gap in the way that the EU governance works, and that ideal of how we see civil society engaging at national level with the EU processes. And I think that's something we really should look at, because the Recovery and Resilience Plan, 750 billion euros being spent through the EU member state governments, with actually very little accountability and involvement of the stakeholders who should be benefiting if we are really serious about tackling inequality and addressing the equity issue. So that's where we were coming in at it from the Early Childhood Development campaign, that we're very happy to have EPHA as an associate partner. As we know, childcare early years is a priority of the EU Child Guarantee, which was adopted earlier this year. But there's very little understanding about how we can embed a more holistic understanding of early childhood development. It's very much focused on increasing investment in childcare, primarily from a narrative of increasing female labour market participation. Whereas we would be saying, you need to build the foundations of early years, look at the holistic perspective of how children are growing up in nurturing environments from the first months and years, because that is the foundation on which we build healthy, resilient, inclusive societies. So what we're trying to do is to bring that to the national level through national coordinators who own this agenda and have the skills and capacity to engage meaningfully in the related EU processes, the Child Guarantee, the semester, the European Social Fund, and all of these instruments, which are well intended, but actually a lot of it just happens in a parallel universe with a whole load of EU bureaucracies. And I love to hear about the WHO initiatives and how they're involving community, and how we could mainstream that in the EU, which has tremendous economic, political power, which we are not harnessing, I think, in at the moment. So that will be my inputs for this afternoon's discussion. Thanks, Alice.
Thank you very much. I'm very conscious of the time. Wendy, if I can pass over to you, please.
Yeah, thanks, Alice. Hi to everyone again. So thanks for letting me intervene here. I represent the European Cancer Leagues. So we're an association, we're a network of mainly your national and regional cancer leagues, cancer societies. They're all non-governmental bodies serving as really the main source of cancer control information and providing services to the general public. So across the entire cancer control spectrum, from prevention information to screening services, to palliative care, to access to medicines. So what have we learned really during the pandemic and how do we engage with civil society? Well, all members are civil society, aren't they, at the national level? And really, as soon as the lockdown started happening, when COVID hit, we decided to convene everyone, because now this title of the session is people as a solution. And it was already mentioned that people are the solution, but I want to emphasize that people are the solution, but only when we can collaborate and work together. Because during the pandemic and during the lockdowns, people were found working on their own. People had to work from home, not being able to connect and network like we used to. So there was this need then for us we felt the need to convene everyone virtually, and we were able to do that. So when we decided to convene all the CEOs and the council societies, some kind of felt was premature. They said, but we don't know what's going on yet. What's the point of connecting? But, in the end, we got so much out of it, and everyone got so much out of it, because we needed to connect with each other to understand what was going on in the different countries. All the situations were different in the different countries. People, have different lockdown rules, and it impacted everyone, all the organizations quite differently. But there were very many similarities. So, for example, what we found during the pandemic was that non-urgent appointments for cancer patients, so such as screening or treatment follow-up, and maybe some of you have experienced that, where you were called in, for a screening appointment, but then it was canceled. So that really impacted, right? I mean, talking about primary and secondary prevention, so that was impacted because then all of a sudden the healthcare setting needed to accommodate the urgent and increasing flow of COVID patients. And then even for those semi-urgent appointments, they were canceled by patients themselves, because they didn't want to be contracting COVID by going into the healthcare setting with COVID patients. And then leagues and other organizations, this is really one main impact that has really had an impact on civil society, who depend on income coming from the general public, is that they were no longer allowed to fundraise, right? Because everyone's under lockdown. And so normally cancer leagues, they go out, they fundraise, they have events, and they go out on the streets, but they were no longer allowed to do that. And many times these annual events, they do provide the income for the entire year, if not, years to come for these organizations. So that was really a major impact, because when an organization is impacted negatively on the income, that means they can no longer provide the services to the populations they serve. So it's a domino effect. So what did we do? We then started finding out what organizations were doing. So, the more innovative ones started fundraising digitally online, and they were able to recuperate a lot of that income. But, these are lessons that we would not have been able to share with each other, and people wouldn't have been able to learn from each other if it were not for the digital connection. And then here, immigrants and marginalized populations, they're really hit, right? Because they're the main targets of misinformation here. You hear about the anti-vaxxers. Already we experienced the reach of these anti-vaxxers during the HPV vaccination campaigns in all the different countries. And so now they just took it one level farther, with the vaccines, with their COVID vaccines. So, but fortunately we did learn from that. And so we kind of knew what was expected. So the cancer leagues were able to kind of tackle that from the lessons that they learned. And then, we also have the digital divide, talking about inequalities, because virtual telemedicine solutions were coming into play now to replace the in-person medical consultations. But then here's the digital divide, because some people don't have the necessary bandwidth, they don't necessarily have the necessary PC or mobile equipment to do that. And not only at the patient level, but also the doctors had to learn, how do we then, provide consultations to our patients. So the silver lining for that is that, a lot of the healthcare professionals now are kind of experts here and closing a little bit that digital divide. But again, we still have a lot to do here with the marginalized populations are being targeted by the anti-vaxxers and people who are against the vaccines. And then also saying, you see, this is what we told you, you shouldn't do it. And you should really not get the HPV vaccine for your children, for your girls and boys. And then another issue I want to quickly address is that how we're involving in civil society now. How do we build back better? Well, we're continuing to share experiences. We're continuing our fight against vaccine hesitancy. And now, this is going into the COVID vaccine area, because it does, and it can, and it does spill over to cancer vaccines as well. So we want to make sure that that is addressed. And then also at the EU level, now there's the implementation phase of the Beating Cancer Plan. That was the implementation plan was just recently launched. And so there, if you look at the plan, the roadmap, they're not only addressing specific, cancer specific risk factors, but a lot of the risk factors, they spill over, they're cross-sectoral and intersectoral. So I think, this is an opportunity for us all to be able to work together. So now we'll continue to focus on how the pandemic has affected patients and populations, delayed diagnosis, stopping primary prevention campaigns, and again, fighting misinformation, how we're sharing our experiences and that. So it's kind of like a work in progress. We're still learning from each other and from all that. And unfortunately, we don't think that's going to stop, but we're starting to get smarter. And I think we're still, we're managing to reach now the general public to get them to go back into their appointments with the missed appointments that they had. And we see that in many of the countries that is starting to pick up. So thank you very much.
Thank you, Wendy.